Good evening. My name is Dr. RANA ARORA and I'm a gynecologist and an infertility specialist. Today, this evening, we are going to talk about the surgical management of fibroids. In my last talk series, if you have seen it, you may remember that we discussed about the fibroids, various kinds of fibroids and how they affect the reproductive outcomes. So today we are going to just go on further and talk about the surgical management. Essentially, the management can be medical or surgical. We are going to discuss one aspect which is surgical this time. So the main thing which we have to remember and understand is when we talk about the treatment of fibroids surgically, it's important we know where is the fibroid located, exactly what is the size of the fibroid, and what is the age of my patient. These three things help to decide as to what I am going to do with it. Because if you may remember from my last conversation, we discussed about the kinds of fibroids. There are mainly three kinds of fibroids. One which is outside the uterus, which is subserosal, one which is within the muscle layer called as intramural, and one which comes within the uterine cavity or the uterus cavity called as submucosal. So the treatment for intramural and submucosal fibroids is laparoscopy. So we remove these fibroids by laparoscopy. Traditionally, if we see, we used to remove it by laparotomy, which means where you cut the tummy open and take the fibroids out. But with advancements in surgical techniques, we use the laparoscopy, which is also called as a keyhole surgery, which means the incisions which are used to take these fibroids out are very small. They may be 2 or 3 in number, but they are very small in size, and hence the healing effect of these incisions or these cuts on the tummy are very, very rapid. And hence the recovery period after removal of these fibroids is very quick. So hence, if you are looking for a fibroid removal, it is important that you discuss with your doctor that it should be removed laparoscopy wherever possible. Now, talking about the size of the fibroids, because the size of the fibroid comes into picture whether we really need to remove it or not. Because there are some fibroids which are very small. As you may recall from my last lecture, that fibroids can vary from 1 centimeter to 10, 20 centimeters. If they're very small, we do not need to take them out, because it's like a very common feature in the uterus which can be found in the reproductive age group. So finding fibroids can be a common thing. But the fibroids which cause pain, fibroids which cause heavy bleeding, fibroids which cause infertility problems or reproductive or pregnancy problems, they are the ones which we need to remove it. So how do we decide which one to remove? If I just take by size, generally we say the fibroid which is bigger than 3 centimeters, 4 centimeters may need removal at some point. Having said that, there are fibroids like maybe a 4 or 5 centimeters which are just sitting there and not causing any problems. So I'm not talking about the fibroids which are not causing problems. Fibroids which are causing problem can vary from 3 centimeters and more. So we should think about taking them out. Generally, if we talk from fertility point of view, the fibroids which are outside the uterus like subserosal, they generally don't cause any problems. But let's say a woman has been trying for n number of years, let's say 10 years, 15 years, and rest every other investigation of achieving pregnancy is normal, and it comes down to fibroids being the cause, then I think even if it's 3 or 4 centimeters, we should take it out if it's subserosal. But if the same fibroid is intramural or submucosal, then I would say that we take it out sooner rather than later. Especially the fibroids which are submucosal, which are coming inside the uterus cavity, we should keep a very low threshold of removing them. Because not only from pregnancy point of view, but these are the fibroids which can cause irregular bleeding also. So these are the fibroids which can give me the most symptoms, which means of bleeding and pregnancy related problems. So before you are planning for a pregnancy, or if it is causing irregular bleeding, I would suggest that we take it out. And for these kind of fibroids, laparoscopy is not needed. they can easily be taken out through hysteroscopic route, which is a keyhole, I would say a telescopic surgery through the uterus. It does not involve any cut. So we put a hysteroscope through the cervix into the uterus and we resect those fibroids. So it depends. If it is a submucosal fibroid, it can be removed hysteroscopically. If it is an intramural or a subserosal fibroid, which means if it is within the uterus muscle layer or outside, they are better removed by laparoscopic route. And I would say that the other thing which is important is that if fertility is not a problem, if the main symptoms are heavy bleeding or pain or problems in passing urine, and if you have achieved your pregnancy and if you are beyond 45 years of age, then you can think about removing the whole uterus with the fibroids. This is a very, very individual decision which one has to take on the other associated factors. Because sometimes with fibroids, there can be associated factors like problems in the ovaries or anything else. So in these cases, I would say individualize yourself. Speak to your doctor as to whether you should just need a removal of fibroid or you need the removal of the whole uterus. So I think this clarifies the surgical management. And in our next series of our talks, we will discuss about the medical management of fibroids. Thank you very much.